Hello, welcome, and today in this video we're going to talk about
In this video, let's talk about the electrocardiogram, also known as ECG or EKG. So the first thing is that the electrocardiogram can detect electrical currents generated by the heart, and also the electrocardiogram, it's going to be basically a graphic recording of the electrical activity, and it's going to be a composite of all action potentials at a given time. So it's not going to be a tracing of a single action potential. It's going to be of all the action potentials. And so in an ECG, all of the electrodes are placed at various points of the body in order to measure voltage differences. Typically, it's going to be 12 lead ECG. So now let's take a look at the actual ECG. Some of the main features you're going to be seeing here, it's the P wave, the QRX complex, and then the T wave. So starting at the P wave represents depolarization of the SA node and the atria. So we're going to get started right here in the posterior portion of the superior area of the right atrium, and particularly the atria depolarization. Then we're going to go into the QRX complex. If you notice, the QRX complex is the ventricular depolarization and of course the atrial repolarization. And the last part of the ECG, it's going to be the T wave, where we have ventricular repolarization. Now, we also have these intervals and segments. So for example, the PR interval represents the beginning of the atrial excitation to the beginning of the ventricular excitation. Then the ST segment, which is this part right here, represents the entire ventricular myocardium being depolarized. And then we have the QT interval, which represents the beginning of the ventricular depolarization through the ventricular repolarization. Okay, now let's start from the beginning. We're going to get started with atrial depolarization. Remember, we're going to get started on the atriums. So in atrial depolarization, it is initiated by the SA node, which remember it's right here in the posterior superior portion of the right atrium, closer to the superior vena cava. And it causes the P wave, so this part right here. Next, it's going to be the atrial depolarization, where it's going to be completely finished. So both right and left atrium are fully depolarized. And the impulse is delayed by the AV node, which is located in this area of the right atrium. Now, this is going to represent the PR segment. The third step, it's going to be the atrial repolarization and therefore the ventricular depolarization. And then in the ventricular depolarization, it begins at the apex of the heart, causing the QRX complex. So this part right here of the EKG. And now also atrial repolarization occurs. I'm going to represent atrial repolarization in orange. The fourth step, it's going to be all the ventricles depolarizing. So when the ventricular depolarization occurs, remember this travels through the bundle branches and the Purkinje fibers. At this stage, when all the ventricles depolarize, now we are located in this part of the EKG, the ST segment. Then we go into ventricular repolarization. I'm going to go and use orange again. So the ventricular repolarization begins at the apex one more time, causing the T wave, this part right here. And at the very end, step number 6, all the ventricles completely repolarize. And this is this part right here. And so we start all over again. Last on this video, it's some examples of cardiovascular problems. So for example, an enlarged R wave could indicate a ventricular hypertrophy. Also, an elevated or, on the contrary, a diminished ST segment could indicate cardiac ischemia. And last but not least, an absent P wave could indicate a non-functional SA node. And that's it for this video. Thanks for watching, and please don't forget to subscribe, share, and like. Thank you so much.